We are looking at this new report, our coastal areas report, highlighting the extent to which communities are being left behind the rest of the UK by virtually every measure of performance. So transport, education, health, wages. The coast falls behind urban areas. This is according to the report. And it was commissioned by coastal groups and councils who say the government needs to harness the extraordinary potential of the coast as a national asset and heavily invest in renewable energy and support high-tech jobs and remote working as well. Well, BBC Radio Sonat's Helen Head has more on this.
The report for the Coastal Communities Alliance describes a low-pay coast with 1 in 5 jobs paying below the living wage and household incomes almost £3,000 per year less than other areas. Children are more likely to miss school and achieve lower GCSEs. And there's higher rates of depression, suicide and alcohol-related hospital admissions. The Alliance wants the government to do far more to level up by creating more jobs at the coast outside of the tourist season. It suggests improving coastal habitats and water quality to bring in more visitors, and it wants better digital connectivity to help home working and incentives to recruit and retain teachers.
Well, Tom Lane is the principal youth worker at Steps Club for young people in Weymouth and told us about some of the challenges that people living on the coast face.
I think there are lots of challenges for young people living in coastal areas and also rural communities, which of course Dorset is both rural and in places coastal. Issues about isolation, issues about, that young people in big cities don't encounter lack of opportunities, particularly more cultural opportunities. We suffer in County Dorset not having a motorway, not having a university. Because of those things, there may be a lack of decent, well-paid jobs, young people being prepared to enter the workplace and able to take up reasonably paid jobs. So a lot of the jobs that are open for our young people when they leave education are in leisure, tourism, care work and retail. And most of those jobs are very, very low paid. The other thing that impacts on our young people is a lack of affordable housing. The combination of low paid work and expensive housing means that there's really been a mass migration of 20-somethings living in Dorset. A lot of young people are leaving Dorset or have left Dorset in their droves and not coming back, which is, again, that's a problem for our economy.
Tom Lane there, principal youth worker. Well, joining me now is Councillor Debbie Monkhouse, who is a member of Swanage Town Council. She's going to be at a community pantry this morning, so she'll tell us a little bit about that. But Debbie, hi, welcome to the programme this morning. Listening to Tom there and listening to our report, are those those common issues that you see, that you hear about here on the coast?
Good morning, Lucy. Yes, absolutely they are. What Tom said there about housing, I think is crucial. The chronic lack of affordable housing due to no council house building. And he spoke about low average incomes and high average house prices. I don't know if you know that in 2020, the rents in Purbeck went up the most anywhere in the UK. So that's a pretty shocking statistic. And as he says, it means that young people growing up here, and also the key workers that our community relies on, nurses, carers, paramedics, they often can't afford to live here. In 2016, Dorset Council did a survey on Swanage, and 10% of the people who responded reported that close family members have had to move away. And from other Dorset Council statistics, the wait for a 2-bed home to rent in Purbeck through the housing associations is up to 28 years. So if people can't live here, then they can't stay here and they can't provide the services here. And another stat, I have done a bit of research here, Lucy, as you can tell. Good. Another stat is that the schools in Dorset, 80% of Dorset schools are underfunded. And the House of Commons constituency dashboard, I looked at it for our constituency, South Dorset. And in terms of the amount of funding given per pupil, we're 468th out of 533 English constituencies. So that's pretty shocking, Lucy. Mm-hmm. And, people may know me because of the campaigns I've led to try and save Paul A&E and then save our town's paramedic car. I mean, we're really affected. I heard that news report that there's going to be extra money. Well, there isn't actually. They're going to take some of the money out of the existing budget and put it into more ambulances. I don't know if you know that the Royal College of Emergency Medicine says there are 300 to 500 needless deaths every week. That's nationally. But of course here, this is basically due to delays once you get in the hospital, once you get into A&E before you're admitted or treated. But I mean, that's here. We've got a long journey to get in the ambulance queue outside the hospital before we even get in the hospital. Yet there's no plans to review the closure of Paul A&E or of the 70 Dorset Community Hospital beds that have been shut.
And we haven't got them to respond to you this morning. But I mean, we do know that earlier this month it was announced that 2 Dorset projects are getting multi-million-pound handouts. This is part of the government's Levelling Up Fund. Weymouth Harbour is getting £19 million to help with the creation of 400 new homes. We've talked about homes there, 400 new homes, a new leisure waterfront complex as well. Bournemouth and Poole coastal communities are getting £18 million to improve seafront amenities and to build a community water sports hub. Do you feel recognised? Do you feel there is that sense of recognition of we do need to level up the coastal communities and something is being done?
No, I don't actually. I mean, my experience here, I mean, it's good to hear about those projects, I would call those really. We're talking about systemic failure here. We're talking about chronic underfunding of public services for the last 12 years that's affected health, education, housing, and indeed the care sector, which really matters here because we've got a high percentage of older people living here. I don't feel... No, absolutely I don't. I mean, as a health campaigner, my experience has been of constant fighting to try to retain the services we've got. We're going to lose our nearest A&E. You know, with 2 years we fought to keep the town's paramedic car, which given that we're going to have an hour to get to A&E once they take it away at Poole, it seems incredible that they're considering taking away the town's paramedic car. We've had to fight to keep our minor injuries unit in the cottage hospital a walk-in service. There was an attempt to close it as a walk-in service. The NHS dentist in town isn't taking any new patients. It's a chronic issue of underfunding, and you know it's being expressed through all the strikes that we're seeing now because NHS staff's wages have gone down in real terms. They're on a much lower wage than they were in, say, 2008.
Okay, so you say it's chronic underfunding. Well, where do you start? You know, we have to start somewhere. I guess this levelling up, this report is trying to start somewhere to help the coastal communities get that fairer deal. You know, do you want funding to be more focused, or what would you like? Where would you start, Debbie?
Well, I would start with not having kind of an ideology around running down public sector services. That's where I would start. We're the 6th biggest economy in the world, and to say that we can't afford to properly fund the NHS, a service that in 2017 was found by the Commonwealth Fund to be the most efficient service in the world, the amount we spend per head on healthcare, we're something like 18th or 19th in the table of developed kind of countries in Europe and worldwide. There's absolutely nobody's ever voted for this. This is about an ideology that doesn't believe in the public sector. That's the problem. So the money hasn't been spent there. It's actually been moved away. There have been incentives to privatise. For example, I know that in our hospitals that at times nurses have been unable to be paid overtime to do extra shifts when they've been short-staffed. But the same nurses have been able to work as agency nurses in their same hospital, costing the NHS a lot more money because it comes out of another budget, allegedly. But obviously there are incentives within the system to funnel money out of the public sector
Debbie,
and into the private sector.
Thank you for talking to us this morning. Debbie Monkhouse, councillor, member of Swanage Town Council. She's going to be at a community patri this morning. A spokesman for the Department of Levelling Up Housing and Communities has said coastal communities play a key role in levelling up, and we continue to support them to improve their economies. Since 2012, we have invested over £229 million through the Coastal Communities Fund to run 359 projects throughout the UK's rural and coastal communities, helping to create jobs and boost businesses.